The full form of AIDS is acquired immunodeficiency syndrome. Now we have to focus on each of the words. First word is acquired. It means the disease is acquired by the individual during the course of their lifetime. The individuals, they are not suffering from the disease from the time of birth. If by chance, if anyone is suffering from the disease, it is only possible if mother is already suffering from AIDS. Otherwise, there is no chance that any child can be born with the disease. So, this disease is not at all congenital or genetic, it is a completely acquired disease. Immunodeficiency terms means that the immune system of the individual is becoming deficit. It is no longer capable of fighting against any kind of infection which the individual is going to be exposed to. And the third term, which is syndrome, it means collection of symptoms. So there can be not only one disease which the individual will suffer from while expression of the disease, they will be suffering from multiple diseases, and that will lead towards the AIDS. If we see that which virus causes the same disease is human immunodeficiency virus. Human, as because human virus, both these terms are used because human beings are infected by this virus. And immunodeficiency, we are already aware, it means the immune system is no longer capable of fighting against any kind of infection. Generally, when this virus affects any individual, at that time it tries to destroy the T cells. T cells are third line of defense, we are already aware, and the third line of defense contains the T cells are of various types, but especially the CD4 and CD8 cells are there. Now, CD4 cells are the primary ones which fight against any infection. So, as soon as the CD4 cells are destroyed, the entire immune system it almost gets collapsed. So as the immune system starts collapsing, so does the disease, it becomes evident in expression. And at the final stage of HIV infection, the various symptoms arises, and these collection of all symptoms leads towards AIDS. So when what is a time period if we need to think of for the expression of the AIDS? It can be from 3 months to 10 years. In this is a long term process in few individuals because the HIV infection, it is going to get completed within this time frame. It can be 3 months for a particular human being, but at the same time it can be 10 years for someone else. So within this course of time period, or we can say that 10 years is the maximum incubation time period for the expression of the disease. And once the expression is done, AIDS is evident. But unless the symptoms are seen, we say that there is just HIV infection. AIDS is not there. AIDS, we can say that the individual is suffering from AIDS only when the individual has reached up till the final stage of HIV infection. That is expression of multiple diseases. We need to understand at least what is the meaning of HIV virus. HIV virus is a kind of virus which infects the defense mechanism of our body, that is the WBCs as well as the lymph. AIDS has been assigned various names from the scientist depending on the kind of infection it expresses or the infection which it causes. One of the name is HTLV3. The reason why this name is given is we will be looking into the full form of each of the letters. H represents human. Human beings are infected, so human. V is representing virus. So human infecting virus is there. And what about T and L? T means T cells are T means T cells, CD4 cells get destroyed at first, and along with the T cells, lymph is also the defense mechanism of our body. So it is lymphotropic. Lymph also gets destroyed because of this disease, and as a result, the infection is going to collapse the entire body. It's defense mechanism. So the full form is human T lymphotropic virus type 3 because of the kind of infection it causes. Next name which is given to it is the LAV virus. The reason why it is given this name is again L for, yes, lymphadenopathy. It means lymph starts having cancer, and because of that, the individual is going to express the disease. So, what is the full form? Lymphadenopathy associated virus. Lymph gland having a adenopathy, it means cancerous cell, and as a result, the virus is getting expressed. So, this is these are two of the important names other than the HIV, which we are already aware of for the same disease. There are various modes of infection or transmission of the AIDS. Primary one is the sexual intercourse. If anyone has sexual contact with an infected individual, so those individuals are supposed to suffer from AIDS. Second is the infected needles, because you may have heard of that we should never use a used needle. We should always check whenever the doctor is going to give you injection, that is the needle completely new or not. That is something which is a very primary thing which an individual should check, because when a needle is inserted into any individual, at that time some of the blood and internal tissue fluid comes in contact with the needle, and if the same needle is used on someone else, then there will be contact of the same blood or tissue fluid to the next individual, and if the first individual was suffering from the disease, it can get transmitted to the second one. Third is blood to blood contact. Now, this can be thought of in two ways. One can be blood transfusion. So, if you think of blood transfusion, if anyone has met with some injury and as a result they need some blood, at that time it is very important that the donor shouldn't be HIV positive. Second way by which the blood to blood contact can occur is if some individual has met with an accident and some third person or second person tries think that one individual A is already suffering from HIV and has met with some accident and he or she is bleeding. At the same time, if some second person goes and tries to help that person, at that time this second individual also gets some injury. At the same time, if both the blood of the infected as well as the uninfected person come in contact with each other, that can be also a source of transmission of disease. So this also has to be kept in mind while helping any individual whom you are not aware of. You should take proper precaution that your blood should not you shouldn't get injured while helping the second person, and even if you are injured, at the same time that bruise shouldn't come in contact with that person's bruise, because that can lead towards HIV infection if the individual whom you are trying to help is already infected. Next is